out, Nepal has 7 health workers per 10,000 people. Most ambulances have no medic, just a driver, and patients reach the ER by taxi. We're talking about here. You gave me a solid example earlier. I would love it if we could share that in a while. You built Israel's first trauma unit practically from zero, if I'm not mistaken.
From -0.
From the -0. What suggestions do you have?
अब सपना छैन टाढा नजिक आउँदैछ भविष्य खोज्ने मनले क्रेटाई भी पाउँदैछ साथ विश्वासिलो यात्रा आरामदायक यही हो हाम्रो रोजाइ यही छ साह्रै लायक क्रेटा इभी
Hyundai Creta Electric, undisputed, ultimate, now electric.
There's a data that we have, Doctor, that I want to share with you.
Okay.
Seven people out. Nepal has 7 health workers per 10,000 people. Most ambulances have no medic, just a driver, and patients reach the ER by taxi. We're talking about here. You gave me a solid example earlier. I would love it if we could share that in a while. You built Israel's first trauma unit practically from zero, if I'm not mistaken.
From -0.
From the -0. What suggestions do you have?
Listen, our story is really, it's what I said is trauma against all odds.
Trauma against all odds.
Yes. That's what happened in Israel in my hospital. Everybody was against the trauma unit. Everybody.
Which year was this, Doctor?
1990. Let's start from 1990, 1992, etc. Okay?
You graduated in 1973 and in 1980?
No, I graduated in 1980. 80. I started my residency in 1980.
Yes.
I spent it's 6 or 7 years residency, and then I went to Baltimore, Maryland. Shock trauma unit, the best, supposed to be the best trauma unit in the world, and I was accepted there, and I built my career according to what I was there 2.5 years. I will tell you,
yes.
The main idea is that I was very happy in Baltimore, very, very happy in Baltimore. My director general from the hospital came to visit me in Baltimore, and he saw everything.
Yeah.
He told me, listen, Avi, don't come back. That's why I told you trauma against all odds. He told me, they love you here. I spoke with them. They admire what you are doing. You're talented surgeon. They love you. Stay there. Don't come back to Jerusalem. There will not be, never, ever, a trauma unit in Hadassah in Jerusalem.
They wanted you to stay at Maryland,
yes.
At the university.
Yes.
In Baltimore.
In Baltimore.
What made you go back home?
Just a second. It's not so simple. Trauma against all odds. I wrote a letter to the Minister of Health, the late Motagur, a famous general that was very popular in those days after the 67 war, etc. He was a parachute by his so-called profession. And I wrote him that I want to come and to establish it, all this stuff. And he told me, I have it until now, his letter. Dear Dr. Rivkind, we are okay. The system is okay. Don't confuse us with fact. We are going to continue on the same regime. Have a nice day. Stay in Baltimore. All the best. Greetings, Mota. So, taking into consideration, now I'm here, with white hair and all this stuff. And this time I was with curly hair.
Yeah.
Curly hair, more black than you.
I'm sure.
Believe me,
Doctor.
with curly hair, not so polite. And you receive 2 no's. Not no, no. With the N, big N, big O, from the people that have to make the decisions.
Yeah.
My director general
Wants you to stay.
wants me to stay. The minister say,
Don't
stay,
come.
don't
Yeah.
come, don't come back. So here we are. And I came back. And I started from zero. Alone. I changed things that were in Hadassah from ever. Head of the departments. I told them, listen, I want, for example, that the chest drain, in the past, the chest drain had inside a metal needle. So you make the incision and then you push
The needle.
the needle, and then later on you insert the chest tube. But it's so heavy, and it's one direction. So I saw personally that this needle went to the pulmonary artery, to the liver. I came back with the greatest idea, Nobel Prize. I am joking. To take out the needle and to put it with the open incision, first of all the finger, and then insert. You know what? It was revolution in Hadassah.
Nobody had
The
done
guy-
it. Yeah.
The guy is crazy. Be aware, the guy is totally out of control. That's the simple. The other one was, we had the operation of trauma patient,
Yeah.
and I came out from the OR with a open abdomen. We called it open with a plastic bag. It's called Bagota bag that I saw in Baltimore.
Mm-hmm.
And I came out to the recovery room, and my boss told me, Avi, what's that? I told him, listen, it's called Bagota bag. That's what we are doing. We cannot close the abdomen. We'll close it later on, and all this stuff. He told me, what?
Mm.
Come. I will teach you how to close the abdomen. I told him, Professor Dur, do me a favor. Leave the woman. Let me treat her my way. And let's see. Give me the chance. Please. You send me for 2.5 years to a place. Don't give credit to me. Give credit to the place. It's not that I invented it. There are some things that I invented, but this one, not. It was a regular practice in Baltimore in shock trauma. I begged him. I really begged. He said, oh, you know what? I will keep an eye on her and on you and see what will be. Sarah. Thank God
She survived.
she survived. Thank God later on we closed the abdomen and nothing happened.
So the things that you learned in Maryland, in Baltimore, you went back home and you utilized that as much as you can.
As much as I can. Luckily enough, I had a nurse that was convinced by my movement, by my willing, by enthusiasm, whatever. And she told me, listen, I'm interested in this field, and I want to be with you. Unfortunately, her name is Etty. She died, but she was, my right side hand, my left side hand. She fought with me all the wars against this and against the other, and together. And later on, there was another resident. And, you gather together your forces, the pro forces for the trauma unit, but it's a process. It's not revolution, it's evolution.
Dr. Avi, in the same conversation, I'll give you another example. 7 people die in Nepal's roads every single day that we were talking earlier as well. I believe you've created a youth road safety program in Israel.
Yes.
Would you mind sharing that with us?
No problem. And that's also happened after such a disaster. In the high school, in a school near Jerusalem, but in the same area, they celebrate the finishing of the high school.
Yeah, a party.
A party. They went from their place to another place, to a restaurant to celebrate. And on the way, they had a road accident. 4 of them died. 3 on scene, and the other one was brought to us. I remember it vividly now. He was in the recovery room with severe head trauma. Head trauma. Family came, mother, father, and sister. You can imagine, you have to speak with them and to tell them, dilated pupil, no chance to survive, We left him. After a couple of days, he died. It's, they are almost 18, 17 and a half. You see the mother, you see the father, and you see the sister. I said to myself, listen, it's very nice that you're treating trauma, etc. However, you should do something to prevent the disease.